Artificial intelligence is sweeping the world as technologies like ChatGPT become part of our everyday lexicon. And Microsoft thinks its AI could end up in your doctor's office. The Microsoft AI team is investigating how AI can help diagnose medical cases. A new study from the team today shows the firm's diagnostic orchestrator, which uses OpenAI technology, can correctly diagnose up to 85% of case proceedings in the New England Journal of Medicine. This is a rate more than 4 times higher than a group of experienced physicians, and it's more cost-effective, according to the findings. Joining me now is Mustafa Suleyman, CEO of Microsoft AI. Good to see you, Mustafa, a longtime follower of your work. So let's start on the news here today. How will this breakthrough, how will this help the healthcare system moving forward?
Well, the incredible thing is that we at Microsoft AI already have 50 million health-related queries per day coming through Copilot and Bing. And our goal is to try and provide the most high quality, most accurate, and ultimately the cheapest health advice and support to all of our consumers and to many more in the future. So although this is just early research, we're hoping that as we get this into production, it will give everybody access to very high quality health information.
The first thing I thought of, Mustafa, when I saw this, why do I need my physician? And does the physician over time go away because of these advances in AI?
No, you definitely still need your physician. Your physician is going to be there to make the right judgment call at the right time, to plan the treatment that often comes right after the diagnosis, and essentially to oversee and organize and hold the AI itself accountable. Essentially what these models are doing is that they're looking at the vast array of existing medical information, synthesizing it and presenting it back to the human at the right time. This is an amazing interactive experience. AIs are now actually asking questions of the data themselves, recommending what tests to get, and then iteratively, sequentially improving the accuracy of its diagnosis as it learns more information. And so doing that in partnership with physicians, themselves is clearly going to be the way that this gets rolled out, I think.
How are physicians getting trained in AI?
Well, today, you have to pass the US MLE, the medical licensing exam, and you need to get about 60% on multiple choice questions. These models get upwards of 95% accuracy on those questions. But the really unique thing about this model is it doesn't just use one AI, it actually uses all 4 of the big major AI developers and essentially goes to whichever one is most accurate at any given time. And that's what the function of an orchestrator is. It decides when to use a big model or a small model, or when to use lots of thinking time or a little, and it is able to kind of get a much more accurate answer by taking the best of all possible models.
In many cases, healthcare decisions deal with life or death, Mustafa. How do you build trust in this technology?
Well, the cool thing about this method is that you can actually see why the AI is coming to a particular conclusion. And as you add more data, it updates its best estimate of what the diagnosis is likely to be. And so that gives a lot of transparency around how it's thinking, what data it factored in, which tests it does. So this is actually an unprecedented amount of transparency, which of course is key to trust, because you can actually go back and look at the entire conversation that took place between many different agents that are all coordinating with one another to debate on what the most likely diagnosis is going to be. And that, I think, ultimately is the best way to improve trust.
Early this year, Mustafa, I had a chance to talk to Microsoft co-founder Bill Gates. He gave your book, The Coming Wave, a shout out. Compared to when you wrote that book a couple of years ago and today, just given how fast things are moving in AI, are you more or less concerned about the power of AI and risks associated with it?
I think I would say I'm about the same. I think that progress has been phenomenal and things are getting better and better. The models are getting much, much smarter. But I just couldn't be more excited about that, because this is the dream of having models that can help humanity solve our biggest challenges. I think we're going to see the greatest productivity boom in the next 10 years we've ever seen, because after all, intelligence is the thing that invented all the tools and technologies that has improved civilization for many, many centuries now. And we're now about to make that a cheap and abundant resource that everybody can use to invent and be entrepreneurial. And it's not that there aren't risks, it's just that the opportunity is absolutely enormous for everybody. And that's how we should measure technology. Does it always improve the human condition? Does Does it always elevate humanity and make us smarter and more productive and safer? And that's the test that we should hold it to. So that's why I'm so excited about, the steps that we're taking here towards medical superintelligence. Imagine having the absolute most perfect medical diagnostic superintelligence in your pocket at any given moment. That's the kind of AI that I'm sort of really pursuing, I'm most excited about.
And Mustafa, it's within this research, you did mention that it was utilizing OpenAI's O3 model. And of course, Microsoft and OpenAI have had a really strong relationship since 2019, but reportedly that relationship has begun to fray a bit. From your perch, what is the status of your relationship? I mean, Microsoft has invested, close to $14 billion in OpenAI?
I think the relationship's in pretty good shape. I mean, OpenAI is an incredible company. They're on an explosive path to growth. And, they're their own company doing their own thing. And we've had an amazing relationship for 5 years, and it will continue for at least another 5 years and hopefully many decades after that. So I think it will go down in history as one of the best technology partnerships that there has been. And so, naturally, that's always going to require constant iteration and evolution. So I think it's in great shape.
Are you close to resolving any differences?
Absolutely. I mean, I think it's been an ongoing discussion for a long time now, upwards of 6 months or so, and it's a very complicated contract and, lots of tweaks need to be made. But fundamentally, these are two companies in a great alliance, and I think that's definitely going to continue.
As someone that has been on the ground floor of AI, such as yourself, of course, co-founded DeepMind many years ago, does the switch to for-profit for a company like OpenAI, does that add more risks to society over time as their technology gets even stronger?
Look, I think the good thing about OpenAI and, my previous company, Inflection, as well as Anthropic, and a lot of efforts that we made at DeepMind, is that all of us founders of these AI companies have started out with asking the question, what is the public benefit? How does this serve humanity? And we've tried to experiment with different legal structures to do that, different incentives for the company itself. But we've definitely put these issues of the ethics and safety of these applications right on the table, front and center, for the last 15 years. And I know that whatever structure OpenAI takes, the team there is going to continue to do that.
And this comes, of course, really